So my name is Colleen McCracken. I am a nurse educator actually from Milwaukee, Wisconsin, and I am a volunteer, much like many members of our ONS Congress content planning team. So I am your chair of the 2024 ONS Congress, so the 49th Annual Congress. I'm really excited to see everyone in DC. The attendees can expect so much this year. Our planning team has been working for an entire year to bring you the best content. How we look for the content, we look at what's been going on, what you guys are posting on the communities, what's been going on in clinical practice. And that's where we take all those ideas to find the sessions and the speakers. We look for speakers from across the country to ensure we're meeting the members' needs. So you get what you want to see at this conference. You're learning from the experts, but then you're also learning from each other, which I think is so valuable, right? We learn from each other every single day, and that's what's exciting about Congress. So we have so many sessions for you. Sessions like patient advocacy. How can we advocate for patients, even on a national level? So local, regional, and nationally, how can we advocate and be that voice for our patients? We have sessions about artificial intelligence. I mean, how many of us have seen that in the literature more and more in the last year? So we've got an amazing session on AI and its use in nursing practice, and then also AI use in nursing research. There are sessions about radiopharmaceuticals. So there are sessions specific to radiation nurses, specific to advanced practice nurses, to clinical practice nurses, to leaders and managers and educators. But we always tell people to go outside your comfort zone. If, I'm not a researcher by trade, but if something in the research track really interests me, attend that session. Get the best of your experiences, get the best, and again, learn from the experts. I think one thing I want to point out to the attendees is the sessions are fantastic. But don't forget to check out the learning hall. So in that learning hall, there are exhibitors from different pharmaceutical companies, different EMR companies from all across the country who are really looking to collaborate, because what they want to do is offer the best of patient care. They want to work with the bedside nurses. They want to work with the nurse researchers to see how can we advocate for patients. What can these different exhibitors offer us to help make our jobs easier, right? And that's what we want, right? We want to have these great partnerships with different exhibitors. Also, the ONS campus, ONS clinical staffers are there waiting to hear from us what we're struggling with and what, again, can make our jobs easier. How can ONS help us achieve our objectives? So I definitely want the attendees to stop by the learning hall, stop by the exhibitors, the ONS campus, and just, again, make the most out of Congress, make the most out of those networking opportunities where we can learn from each other, all to really enhance patient care. Another place I would love for new and experienced attendees, if you're new to Congress, if you've been to, if this is your 50th year at Congress, I always think the poster and project presentations are so valuable. This is where you can learn from different nurses from across the country who have submitted their work as an abstract, gotten accepted as a poster or project. Then you can learn it. What change did they make at their organization? Honestly, this is where I learn and I think of, ooh, how can I implement this at my organization? And again, those networking opportunities, in the past, I've reached out to poster presenters who I've met in the elevator. They've given me a business card, said, check out my poster. I've reached out to them after Congress, and we've had calls about how I can implement similar like things at my organization. Again, another way to network, work with other oncology professionals who are doing the same jobs as we are, and let's work together to, the best education, the best care of our patients. And then they've done something well that works really well at their organization. That's wonderful. How can we learn from that and adapt it to our own organization? While I am the chair of the ONS Congress content planning team for 2024, I have an amazing team. I have 10 volunteer nurses from across the country who have helped from day one, donated their time when they have full-time jobs, just like I do, donated their time and their expertise to plan this conference. And along with those amazing 10 volunteer nurses is ONS. The Oncology Nursing Society staff have been instrumental in making this conference a success. We couldn't have done it without their guidance and their expertise every step of the way. And so just really thanking everyone, number one on my team, but also thanking the entire staff of ONS for their help and guidance along the entire way.